Hi there, it's Morgan
and Allison from the Underserved Populations Program, and we have been momentarily transformed into cartoon characters to talk to you about health equity.
If you're asking why, maybe a better question is why not?
So, what does health equity mean? If you took a few minutes to Google this, you would find lots of definitions. To sum them up, health equity is when everyone has an opportunity to reach their full health potential, which is to be the healthiest they can be.
Unfortunately, many barriers and obstacles prevent us from reaching our full health potential. And for cancer patients, these barriers can have profound negative implications. While some factors such as genetics and biology are out of our control, there are a number of things we can do, both as individuals and as a society, to increase health equity.
In fact, according to the Canadian Medical Association, only 15% of our overall health is attributed to our physiology and anatomy. The rest is based on our environment, the healthcare we receive, and our overall life. That means 85% of our health is determined by factors other than our actual biology.
What's even more interesting is that 50%, that's right, half of our health is determined by life and lifestyle characteristics. Things like education, income, access to healthy and nutritious food, race, ethnicity, gender, and whether we live in a safe home. These characteristics are often called social determinants of health, and when altered, can help people reach their full health potential.
We know that social determinants of health are shaped by larger structures and institutions that support or limit someone's health. But that doesn't mean we can't do anything to create change. It needs to start with our perceptions and recognizing that we are all individuals. Our health is influenced by different factors in different ways. That means we can't treat everyone the same and expect it to result in identical experiences and outcomes. Instead, we need to look at this from an equity lens and understand that sometimes we'll need to do more for someone based on their individual needs and circumstances.
Take, for example, these two raccoons who are about to race one another. Do you notice any differences between them? I didn't think so. But what if I tell you that raccoon number 2 hasn't eaten in the last 5 days because a mudslide came and washed away his home? So even though he knew he'd be racing, he was more concerned with getting somewhere safe, which meant going to a place where he couldn't find food. And now that you know this, who would you bet on winning? Yeah, raccoon number 1 has a pretty big advantage here and would likely win. Unless, of course, someone were to feed raccoon number 2 some food to help him.
But wait, doesn't that mean that raccoon number 1 should also get some food?
Well, from an equality perspective, yes. But thinking about this from an equity perspective, does raccoon number 1 actually need it? Since she didn't have to deal with a mudslide and already ate before the race, probably not. But you, as a spectator, even though you can't do much to fix the mudslide, you can give the crumbs in your pocket to raccoon 2 and help him out.
Now we know when it comes to patient care, it's not going to be as easy as giving your extra food. But you're not alone. Remember, the Underserved Populations Program is here to help you provide our patients and their families with the best possible experience. But before we can help you, you need to put on your equity lens and remember that we can't treat everyone the same to get the same outcome. Oh, and if you're wondering who won the race, it was a tie.